Dengue fever is a mosquito-borne disease caused by the virus transmitted via the Aedes mosquito bite. Dengue fever symptoms usually appear 3 to 14 days after infection. Headache, high fever, vomiting, joint and muscular discomfort, and certain varieties of skin rashes are also possible symptoms. Recovery usually requires 2 to 7 days. The sickness progresses to a more severe form of dengue hemorrhagic fever in some instances. It can cause bleeding, decreased blood platelet counts, and blood plasma leakage in the affected body. Alternatively, dengue shock syndrome causes extremely low blood pressure. Dengue is spread by numerous female Aedes mosquito species, including Aedes aegypti. There are 5 forms of the virus. Sickness with one type results in lifetime immunity but only short-term resistance to the others. Infections of many forms raise the risk of severe consequences. Various tests are available to identify dengue fever. The most important is the virus or its RNA-resistant antibodies in the body. Dengue fever vaccines have been generated in many countries. Still, they are only effective in people who have been infected once. The primary method of preventing dengue is to avoid Aedes mosquito bites. As a result, to limit the spread of Aedes mosquitoes, their habitat must be destroyed. Water should be removed from areas where Aedes mosquitoes lay their eggs. Particularly water stuck in tree tubs, coconut shells, cups, roofs, etc. Aedes mosquitoes generally bite in the morning and evening, when you should sleep with a mosquito net. Small children, in particular, should always sleep under a mosquito net. A person suffering from dengue fever should consume more fluids than usual and rest thoroughly. To lower fever, doctors prescribe taking paracetamol. The majority of the time, the patient must administer saline intravenously. If the patient's condition is critical, it may require blood transfusions. Non-steroidal anti-inflammatory drugs and antibiotics should be avoided. Every year, many people in Bangladesh die from dengue fever. Dengue prevention is something that we all need to be more aware of. The government is taking several initiatives to avoid dengue, which is admirable. It is never to be taken lightly. We can prevent people from becoming infected with dengue fever and reduce the fatality rate if we take the right actions.